उधर एक ब्लू शर्ट है आगे घर के सामने, उसके पॉकेट में डाल दीजिए। हाँ? ओके। Namaste. Am I audible? Am I audible? Okay. I think I'm audible. Uh, and I think in text, can you text me whether I'm audible? That hand raise, Dr. Satish means it is I am audible. Okay. So we will start today's session. Uh, welcome back for the one more live session. Okay. So I'm very sorry for last week's session because actually we planned for Saturday and unfortunately I was not able to join that one because of some other works. So again, I planned on Monday. Again, that was also not possible. So today we are doing. And again, one more. Sorry for those who failed to. What is that? I can say like. Doctor, not audible. I'm not audible. Hello. But many are telling I'm audible. Dr. Satish, am I audible? Dr. Praveen, please unmute and hello. Am I audible? In YouTube, people are telling I am audible. Someone who has joined from our Zoom, can anybody tell me whether I am audible or not? Hello, Dr. Satish, Dr. Ayushi, Dr. Anand, Dr. Anuja, Praveen sir. Anybody please tell me whether I am audible or not? You can unmute and hello, not audible. Okay, just a minute. Am I audible now? Hello. Sir, am I audible? Yes, yes. Okay, okay, thank you. Okay, very sorry for uh, the issue with the link in the previous session. I think there was some issue with the previous session to connect in the on our platform. Very sorry for that. Uh, okay, we'll start today's session. So, as I usually start with the case, this case is associated with the case which we are going to discuss is associated with one of the question. So that is why first we'll take the question and then we'll go with the case. The question is one patient had cracked heel in only one leg and formed wound since 30 years. Wound is not getting cured or not healed. Patient is Pitaka Prakriti. Sir, how can we treat this patient wound? Is it Paduka Roga? Please explain. Now, whether it's a single wound or multiple, like single crack or multiple cracks, it is like, Padadari, like what you can say, a crack. Dari is a crack. So, if it is there on the Pada, it is to be considered as Padadari or Pada, like Vipadika. So in that direction only we have to treat. Only thing is, when we are considering it as Vruna, the selection of medicines will become little bit different, right? We need to be having a different kind of selection of medicines. Like I think you have gone through the Vipadika sessions where the no, medicines are varyingly selected. But in this, we'll see a case which is a wound. I think some 4 or 5 years old. I think we have published this case. It is 4 or 5 years old. History is there. He's having wounds. A large wound here. You can see it's like a almost like a pit, and it is oozing and foul smell is there. And there is even at the lateral malleolus on the right. I think this is right leg. Yes. On left side also there is a big crack with again some injury on the lateral left lateral malleolus. Right. This is the case with history of 4 to 5 years. Now, when patient came on the first visit, I have taken it directly from. I searched for that PPT. It's not getting, so I have taken it directly from the article that we have published. So first visit, cracks on one on left heel and two on right soles associated with pain and rarely with discharge and foul smell. So in the beginning, what I have given him on the first day, Nimbadi Kashaya, 15 ml thrice daily after food with half cup of warm water. Dashang Gulika, 1 tablet thrice daily after food with the Kashaya and warm water. Tripla was given for washing, and then Marichadi Malara was given for external application. This is on first visit. On second visit, I will share the article later. On second means first follow or second visit. Patient came with the complaint of oozing. Now oozing has increased. Foul smell over right sole from the lateral that wound, and left sole was healing. So left sole where big crack was there, that is healing. Whereas the right one where that big pit-like thing was there, that was showing more oozing and foul smell was there. Then after that we admitted the patient only for Shamana Aushadhi only. We did not go for any Shodhana because he was reluctant to stay in home. तो उसके घर वाले बोले कि उसको इधर ही रख लीजिए, वो बाहर बहुत घूमता है, तो इसलिए we kept him in the hospital for just Shamana. So in that this was done. So only Nimbadi Dashanga was there. So now I added Patolakatrine because now oozing and all has increased. Okay, so Park is taking place more. So here whether this increased oozing and all is a positive sign or negative sign. Again, we have to take it as a positive sign because whatever Dushta Kleda is there inside, that is getting eliminated, that is getting removed. When there are wounds, that gets cleared. And simultaneously, we are doing Trifla Sekha and applying Marichadi Malara. So Malara, when we apply oil, its retention time is comparatively less. When we apply oil at that time what happens, retention time will be more, and it causes a kind of more of Shodhana effect, Vruna Shodhana, scraping type of Lekana or Shodhana type of effect. Okay, so because of that, the patient started oozing. So only change was we introduced Patolakatrunadi thrice daily 1 hour before food. Imbadi, Dashanga, Tripla and Marichadi was continued as it is. Second follow, lesions were completely healed. Only a circular lesion of right sole is persisting at the lateroventral part of little toe, that right side, which wound was there, big wound. Oozing was slightly present and occasional bleeding was seen. Foul smell was absent. So occasional bleeding for long time walking, if there is any like wound is there, then the bleeding. Now this bleeding is the sign of increased vata. Increased vata, how bleeding? Because fresh bleeding is always because of wound, right? Fresh bleeding is always because of wound. So when you will be walking, so because of the increased dryness of the lesions, there were cracks. So those cracks led bleeding, right? Those cracks led to bleeding. So that is why the bleeding was there. So what we did, we changed now medicine. Now Karya we have treated. Whatever outcome was there, that we have treated. Outcome was there, that we have treated. Now we need to focus on Karana. Now why that became that Dushtavruna type, why it became like that. So Kleda is the most important thing. And now patient is having oozing also, like bleeding also. So we need to treat for Vata also, and simultaneously we should not aggravate Kleda, right? So Kalyanakarta, morning on empty stomach. 10 ml matlab 2 teaspoon morning on empty stomach. Ayaskriti. Ayaskriti is Asanadi Kachaya only, Asanadi Ganam, but it is more Tikshna than Asanadi because it comes with Loha. Mandaloha, what we call Loha Kitta type Ayaskriti. I think if you read the method of preparation of Ayaskriti, you will understand, right? So that it is heated and dipped in so Arista, like Arista, heated and dipped in Arista. So like that it is prepared, right? So Kalyanakagrita, Ayaskriti. Kalyanakagrita was given on empty stomach. Ayaskriti 15 ml thrice daily after food. Kaishar Gugul. Actually, I wanted to give Nimbadi Gugul because for healing, Nimbadi is the best choice. But on that day, Nimbadi was not available. So that is why I went with Kaishar Gugulu. That is also okay because Kaishar Gugulu is very good for Vatarakta. And Acharya said for this, you take it as leg. So what is this? Ankle joint and below, whatever wounds and all happen, we need to treat them from the angle of Vatarakta. Acharya Charaka has explained this. Akur Vishayava, something it is said like from the ankle it starts like that, right? So Kaishar Gugul is also okay. So that is why I prescribed Kaishar Gugul. Otherwise, I would have gone with Nimbadi Gugul at least at that time. So Marichadi Malara, now we stopped doing Seka because there is no clay and all, it's completely drying. So Nalpamradi Taila application first, over that, above that, Marichadi Malara. Right? It was done. The third follow-up means fourth visit. Actually, at that time, there was no wound at all. But during that period, he fell somewhere, fallen and injured to his right foot with slight edema and slight pain. No fresh complaints about the wound. All wounds were markedly healed. Right? So now I needed to continue Grita, but now wanted to give only one. So Google Tikta Grita is best even for the fall, if at all there is ligament injury or bone injury. So Gugu Tiktaga is very good. So as I told, like I use Gugu Tiktagrita, I do not use, I use GT capsule. So I went with Gugu Tiktagrita capsule. One capsule thrice daily after food with warm water. Marichadi Malara and Nalpamradi external application were continued. You can see the outcome. I think 2.5 months we have treated. I think 2.5 months, maybe. Not sure about the time. I will share the article later in the group. Right? This is before treatment and this is after treatment of the right leg, and this is the left one. You can see here, you can see lateral malleus, slight dryness is still there, dry thick lesion is still there, but these wounds are completely healed. At this time, I gave him the GT capsule and Marichadi Malara and Nalpamrita, right? After that, patient has not come for any follow-up. I think you understood this case. Now we'll go with questions, remaining questions. So the one question is, Namaste sir, what is the mode of action of Nalpamrita in hypo to hyperpigmentation? Many times I have told like Varna Utpatti, if we read, that will give us a very good idea about selection of Varnya. For example, Manjista is Varnya, Yeladi Gana is Varnya, Sahachara is Varnya. Sahachara is also Varnya. Panchavalkalas are also said to be Varnya. They all are, when we look into them, Varnya is not, but in our mind it's always there. Now Varnya means fair. What is that? Varna means fairness. Varna is something which brings fairness. No. Varna is, it is bringing to the normal color of the individual. Bringing to that original normal color is called as Varna. So when there is hypopigmentation, so we need to bring back that to normopigmentation. When there is hyperpigmentation, we need to bring back that also to the normopigmentation, right? Normal pigmentation. So for this, we need to understand the Varna Utpatti. This is from Sushruta, Acharya Sushruta, right? Sushruta Sharirasthana. Forgot to add the chapter name. You can just refer. I think Purisha Vedia something. Fourth, not remembering correctly. Fourth chapter, maybe third or fourth chapter. So what this reference says is, most important is Tatra Tejo Dhatur Varnanam Prabhavaha. So Agni is the source of Varna. Right? Agni is the source of Varna. Like how Prithvi and Jala are said to be the source or the what you can call Karana Dravya for Rasa Utpatti. Likewise, Agni is the Karana Dravya for the formation of Varna Utpatti in the Garbha. same is true after birth, like portion of that, how the Agni Mahabuta is there. Depending on that, the person's complexion, color, all those things are going to determine. So what it is said, when this associates with Ap Mahabuta, that is Jala Mahabuta, there will be Gauravarna. When Prithvi gets more associated with Agni, then Krishna. Prithvi and Akasha, then Krishna Sham. Right? Toya Akasha Dhatu Prayo Gaura Shamam. So what it is said, now our focus is we are using Nalpamraj Taila or Panchavalkalas. I think in one of my previous session I told you for Mukadoshika, patient was having severe clay, the stickiness and all. So I think our physics said I never use usually never give Panchavalkala for washing the face lesions, particularly if it is not Visarpa, right? Other than that, acne and all, or oily skin and all. So I think some of our pieces asked why can't we give Panchavalkala? It is so sticky, clay and all. So let us give. So Menigdia, clay and all reduced, but patient came with increased pigmentation. The skin has become now, patient's problem was previously acne. Now acne is not the problem. The color, that darkness of the skin is the problem. Anyhow, next visit, after that next medication, 15 days medication, again he got back his normal skin color. So that is why when we use Panchavalkala containing drugs, they are Prithvi, Akasha, Vayu, Mahabhuta dominant. Particularly Prithvi and Vayu Mahabhuta Pradhana. So when Prithvi and Vayu Mahabhuta Pradhanas, they will go and associate with Agni, then what happens? The Varna hypo to normal. It will become hypo to hyper, or you can say that fair to dark, light to dark. It color moves from dark, light to dark, right? One more is there, like when I gave example of Sahachara. Like for example, you consider Bakuchi, Sahachara, they all are already Agni in nature. Then why we get increased melanin secretion? Right? We use Bakuchi, melanin secretion. It stimulates melanin secretion. Means that is to be used like somewhere. I think in future, I think somewhere one question is there about Shvitra. I think it will go whole like it can answer for that also. So in Shvitra, what is happening? In Shvitra, what is happening is 2 or 3 things will be happening there. One is either the melanin secretion is stopped, right? Varna Utpatti is stopped. Now, what is responsible for Varna Utpatti? What is responsible for Varna Utpatti? Agni Mahabhuta, right? Or Varna Utpatti is there, but it is not sufficient, right? Second one. Third is Varna Utpatti is taking place, sufficiently taking place, but Avarodha is there. That is why it is not reaching the skin layer, surface, Avabhashini. It is not reaching the Avabhashini. So that is why there in Shvitra, these Bakuchi and all that are used, they are Agni and Prithvi Mahabhuta dominant. Agni and Prithvi Mahabhuta dominant. So they not only add to the color, but they are not just mixing with the Agni, but they are taking Agni also simultaneously. Means they are stimulating Agni also. Because that is why they are Tikshna Ushna in nature. Actually, I started using Panchavalkala. I started reading about Panchavalkala after reading Kautilya Artha Shastra. I know. Like sometimes we need to be reading other things also, right? We need to read. We need to read. Each and every literature of India is scientific, and when these literatures were written at that time, only medical science that was existed in India was Ayurveda. So in one or other way, they are connected. Right? They are connected. So there is one chapter you can read. It's very beautiful chapter. 14th Adhikarana, maybe, not sure. But name of the chapter is Langaniya Adhyaya. Langani. Langana means not skipping, like not fasting. Langana is escaping, skipping, jumping, right? Sagar Langana, how the Hanuman jumped, right? It is skipping, escaping that. So in that, what is there? Like in spy, you can consider it like spies. If a spy has gone to enemy land and he has identified some important locations to attack, but somehow he got identified, still he escaped. Now he only has to lead the troop inside that enemy land, but he should not be identified again because he is already identified. He should not be caught. If he is identified means then entire troop will get caught. So that is why he should be his identity should be changed, right? His appearance should be changed. So there are two formulations. I don't use them, but this one you can use. The fair one I will not tell. You can read that one. So what is there? If the spy is fair, then what the Chanakya, Acharya Chanakya says is, you apply Sarchara Kalka, Sarchara, right? Sarchara Kalka, and then give bath of any of the plants, kashayas of Panchavalkala. तो पंचवल्कल के कोई भी प्लांट या पूरा का पूरा पंचवल्कल कषाय लेके उसको नहला दो. पहले क्या करना है? सहचरादि कल्क लेप सहचर कल्क. So by that, what is said? This is Panchadisha Dina Yoga, means 15 days yoga. So in 15 days, the dark person will become, fair person will become dark. Actually, it works. We have given Sachara Kalka in Leukoderma also. We give that, but not Panchavalkala Seka. After removing that lepa, I ask the patient to apply actually Nalpam Raitel. But actually, this Sachara causes mild wounds, wound-like irritation it causes. Then oil application or kashaya seka, when it is done, that heals and that leads to hyperpigmentation. Okay, so mainly the panchavalkala, nalpamaradi taila, that contains panchavalkalas. Mainly, I think one parisha is not there in that, and other haridra, chandana, and all. So they all are Prithvi dominant, Prithvi and Akasha, Vayu, Mahabuta dominant. So when they go inside as varna, they increase the color, right? That is why the hyperpigmentation moves to normopigmentation, right? Ati yoga can lead to hyperpigmentation also. Okay, there is one question. This is common for all types of medications. Can we use these medicines in diabetic, cardiac, and hypertensive patients? Means when a skin patient comes, consider psoriasis patient comes, if the patient is simultaneously having hypertension or diabetes and all, then just a minute, I have to answer a call. हेलो, हाँ बोलिए. हाँ ओके. हाँ ओके ओके ओके. हाँ, मैं उधर आने के बाद मैं आपको कॉल करता हूँ. ओके. हाँ हाँ ओके. हाँ हाँ ओके ओके ओके. थैंक यू. I think I'm audible. Okay. So usually in all skin diseases, most often the skin patients come with comorbidities, like they will be having diabetes, hypertension. They are very common nowadays. So we have to treat them. We have to treat them even with them with those existing conditions. So then also we use these medicines. Actually, whether our medicines interfere with those modern medicines they are taking or not, we don't know. We are not having any. I personally I don't have any idea about that, but still we use them. We continue their medicines, and we use our medicines that are prescribed for the skin disease. Okay. Is it possible to explain Panchabhuta concepts in assessment? How to differentiate each in clinical assessment and treatment? Is it necessary? Now, last question is making it difficult. Right? Is it necessary? Like how we are approaching. Am I audible? Hello? Am I audible?
Yes, sir.
Okay. So, thank you. So, how it is necessary? Like in what angle we are looking, depending on that, it depends. So, necessary or not necessary, it is determined by how we are going to treat the patient, right? So, depending on that, we need to consider like little basics. Like we all know that we all are Shadadatvatmaka Purusha, right? Panchamahabhuta Vikara. Entire body except Atma is Panchamahabhuta Vikara only, right? So depending on these presence or condition of these Mahabhutas, the body, the what you can call the functioning physiology of the body will be determined, right? How it is the state. So what it is said, तत्र शरीरम नाम चेतनाधिष्ठान भूतम पंचमहाभूत विकार समुदाय समुदायात्मकम संयोगवाही, राइट? यदा हि अस्मिन् शरीरे धातवो वैषम्यम आपद्यन्ते तदा क्लेशम विनाशम वा प्राप्नुति. What it is said, so these mahabhutas are in samayoga. Samayoga means not in equal quantity, but they are in equilibrium as per the requirement of the body, right? They will be like that. When they are in that condition, at that time they do dharana of the body. But when there is some vikriti, vaishamyam apadyate tada klesham, when little vaishamya takes place, the person suffers from the disease. If more deformity is there, then vinasham, the person dies, right? It is said here. Now in commentary, what is said, Panchanam Mahabhutanam Vikara is Rasadaya Sharirarambhaka. So Mahabhuta Vikara are nothing but dhatus only, again. Rasadi dhatus, right? और यहाँ पे he goes on explaining about यस्य शरीरस्य द्रव्य रूपस्य तत् पंचमहाभूत विकारः समुदायात्मकं शरीरमेव. So it is nothing but the association of Mahabhutas. So as उचितेन प्रमाणेन means as per the requirement, पृथ्वी कितना चलना चाहिए, जल कितना रहना चाहिए, अग्नि कितना, like that. If they are in their requirement condition, if they are in that state, then there will be no disease at all. The person will be healthy. That is called as samayoga. Now, if it is not there, what is said, samayana uchita pramanena dhatunam melakena samyak nirogataya vahati iti samayoga vahi. So when they are in normal condition, at that time the body will be maintained healthy. So that is why they are called as samayoga vahi. Yadatu dhatunam nyunatiriktena vishamo melako bhavati tada asamayoga vahi darshena. So if at all there is any disturbance in the equilibrium of that, then it will become asamayoga vahi. Then that leads to diseases. Laguna vaishamyena roga matra janakam klesham. Like थोड़ा disturbance हो गए तो रोग होते हैं. महता तु असाध्य रोग जनकेन वैषम्येन विनाशम मरणम प्राप्नोति शरीरम. So if excessive deformity takes place, disturbance takes place in these mahabhuta vikaras, then the person dies, right? Okay, now comes यत्रापि स्वमान स्थितानामेव रक्तादीनां वातादि दुष्ट्या कारकत्वम. So yatrapi, जहाँ पे भी स्वमान स्थितानामेव, like the dhatus are there in their normal condition, right? जितना चाहिए उतना ही है. But what is said, वातादि दुष्ट्या, because of the vitiation of these dhatus by the doshas, then what happens? They become karaka for the roga karaka. Tatrapi वातादय एव वृद्धा प्राधान्येन विकारकरा. So there also, even if we consider the sharira from the angle of Mahabhuta also, there also what is said, pradhanyena vatadaya eva vikarakara. Vruddha matlab vikupita. Prakupita vatadi doshas are the responsible factor for the manifestation of the disease, right? What is said further, raktadaya api yatra dushta dosha sambandadina swaguna guna swaguna vruddha swaguna va bhavanti. So what happens here, two things will happen. One is when these normal अवस्था में रहने वाले ये जो भी धातुस है, महाभूत विकार मीन्स धातुस. So when they are in normal only, at that time when dosha gets associated with that, quantitatively they are not increased, but karma will get disturbed and they lead to what is said, dosha sambandha adina. So the karmas or the gunas of the rasati dhatus will come into the control, adina matlab control of dushta dosha, and then they cause the disease. Or vruddha swagunaha, or sometimes what happens, the gunas of the raktadi dhatus will increase because of the influence of the prakupita doshas, right? Because of the prakupita doshas. In what way it is influencing, depending on that, the disease is caused. So again, they are nothing but the mahabhuta vikaras only. So that is why it is said, tato guna hani vriddibhyam vriddihasau dushyate api tishtete eva na prakritistasya vikarakaritvam iti pashyam. So that is why when the Mahabhutas or Mahabhuta vikaras are there in normal condition, at that time they do not cause any disease. But when they get affected by tridoshas, then they start causing diseases. Right? So there is one more instance. This is from Sharirasthan. Right? There is Angavaya Utpatti and all. So there Matuja, Pitruja, etc. Bhavas are explained. So there is some Acharya Sushruta explains Angavaya Utpatti by Swahava and Mahabuta. He explains on Mahabuta concept. Whereas Acharya Charaka explains them under these six Garbha Utpadaka Bhavas, Matuja, Pitruja, Sattvaja, Satmaja, Atmaja, and Matuja, Pitruja, Sattvaja, Satmaja, Atmaja, and Rasaja Bhavas, right? Okay. So in that, when he is explaining, at that time there comes a question. Acharya Charaka, you are telling they all are Matujadi Bhavas, but some other context. Like for example, Acharya Vishwata is telling they are Mahabhutas. So what Charaka says? Matrujadayo api asya Mahabhuta vikare eva. But he says, the Matuja Pitruja Bhavas, what I am telling here, they are also nothing but Mahabhuta vikara only. So why we need to consider them in the angle of Mahabhuta? There he gives the explanation. How to approach, what for we are approaching, depending on that whether we have to consider Mahabhuta or its vikaras. So what he says, पुनश्च इह भूतजन्यत्वेन अभिधानात् अंगानां चये वा वृद्धौ वा सत्यां तत्कारणभूत भूतप्रयोग प्रतिषेधाभ्यां वृद्धि क्षय जनन ज्ञापनार्थम. So why Acharya said here, Chakrapani explains, इतना सारा मातृजाति भाव बोल के लास्ट में आके he is telling they are also Mahabhuta vikaras. Why he is telling like that? So Chakrapani very nicely explains. पुनश्च भूतजन्यत्वेन अभिधानम अंगानाम. So Angavayas are said to be formed of Matuji Pituji Bhavas, but now you are telling they are formed because of Mahabhuta Vikaras. Why? Because Anganam Chayeva Vruddhava. If at all any Angavayava of the body is getting Shaya or excessive Vruddhi, Satyam, उसका जो भी कारण है, तत्कारण भूत, उसके लिए कारण जो भी भूत है, कारण भूत मतलब what is the cause for that? That भूत उपयोग, क्षय के लिए जो भी महाभूत कारण हुआ है, उस भूत को तत्कारणभूत उपयोग, by administering that Mahabhuta, if Vruddhi has taken place, that Mahabhuta Pratisheda मतलब avoiding, preventing, Vruddhi Kshaya Janana Jnapanartham. So if any Angavaya is formed, if we are able to understand that that particular Angavaya is formed by Prithvi and Jala Mahabhuta, and if it is reduced, so what Acharya Chakrapani is telling, if we are able to understand that particular Angavaya is formed by Prithvi and Jala Mahabhuta and it is reduced, its Kshaya has taken place, then by supplementing suitable Prithvi Jala Mahabhuta Dravyas, we can bring back to normalcy. We can cause the Vriddhi of that Angavaya. If any Angavaya is abnormally grown, and if we are able to understand which Mahabhuta is responsible for that Angavaya, if we restrict the use of that Mahabhuta, then we can bring Kshaya in that. So because of that, Mahabhuta concept is explained. So what is said? Yadangam yadbhuta prabhavam tadangam tad bhuta pradhanena dravena vardate shiyate cha tad viparite. So what is said? Yadangam yadbhuta prabhavam, whichever organ is caused by or origin because of dominance of particular Mahabhuta, by supplementation of that Mahabhuta, that organ vardate shiyate cha viparite tad viparite. If it is opposite to that Mahabhuta, something is administered, then what happens? That Anga will go on reducing in size. Right? So that is why what is very important is for what purpose we are assessing the condition. Right? So overall, to assess Mahabhuta clinical presentations, it is nothing but Paka. It is nothing but the Paka. Association of doshas with the bhutas. Bhutas means nothing but now we have to consider Rasadi Dhatu. So when Rasadi Dhatus are getting affected by Tridoshas, any of the doshas, that interaction we call as Paka, Vipaka, right? How Vipaka is understood? Vipako Karma Nishtaya or Vipako Vyakta Karmanaha. We have to understand Vipaka by its karma. Right? We have to understand Vipaka by its karma. So here you can see, I use this usually, we can call analogy. I think it's there somewhere in the session, right? So here you can see Samayoga. All Mahabhutas, everything is in normal condition. So what is happening? Normal tvacha is formed. Now, what if Vayu Mahabuta increases? Vayu and Akash Mahabuta increases. Then it leads to Rukshata. Right? If Jala Prithvi increases, then it increases. Now don't consider dosha. Right? Don't consider dosha. Right? I use same slides for explaining dosha. Now don't consider dosha. Now when Prithvi and Jala Mahabuta will dominate, at that time the lesions will become thick, bulky. Right? So Prithvi Mahabuta, whenever thick lesions are bulky, thick, they are hard, Prithvi Vayu. If they are soft, mrudu, delicate, then Prithvi and Jala. Right? If they start oozing and all. Now Prithvi Mahabuta, Jala Mahabuta with Agni. Now, depending on the consistency of the oozing, you can consider Jala Agni के साथ कितना है, उसमें पृथ्वी कितना है. If the consistency goes on, like consistency of the oozing goes on, becoming more and more thicker, so understand that with Prithvi Jala Mahabuta, with Agni and Jala Mahabuta, Prithvi is increasing. Right? With Agni and Jala Mahabuta, Prithvi is increasing. Right? So whether you consider them as the dosha or Mahabhuta, no problem. Right? So you can see here Ayama and Shlakshnata. Ayama and Shlakshnata. Tissue loss. Right? Tissue loss has taken place. So what is responsible for this? Vayu and Akasha. Vayu and Akasha. Right? Katina, Asti Charmot, Parusha, rough. Katina, Parusha, they are like, what is that? Sandpaper. What is giving that hardness? Prithvi Mahabhuta, right? What is doing the Prithvi Mahabhuta more and more hard? Prithvi Mahabhuta will become soft because of association of more and more Jala. Prithvi Mahabhuta becomes more and more coarse and rough, hard by association of Vata. Again, what is needed? Agni is needed. Agni has to do that part. Right? Agni has to do that part. You take example of making pot. When we make up, like like the potters, pottery बोलते हैं ना, उनको कुंभार जो रहते हैं. ओके, सो जो बनाते हैं, जो पानी और मिट्टी में पानी घोल के बनाते हैं, तो उसको ऐसे ही सुखाए तो उसका टेक्सचर कैसा रहता है, उसमें उसको आग में जलाए तो उसका टेक्सचर कैसा. Right? So when Agni associates with that, then actually the real part starts taking place. So that is why I think I have explained that somewhere. Now Udrutta Bahi Twak. Udrutta Bahi Twak. I have explained that whenever there is Jala Mahabhuta underneath the skin, peeling will start. Easy peeling because of that Snigdhata. Snigdhata is coming by because of Jala Mahabhuta, right? Vayu and Jala is there. Vayu, Jala, Akasha. Bahu Bahala Puya. Secretions are there, right? Secretions are coming. Why there is Puya? Paka. Pitta Drite, Paka Drite, Nasti Puya, right? Paka ho raha hai, Agni is there, right? What is the form of that? How it is appearing? Vipaka, how it is appearing? It is appearing oozing, in the form of oozing. So how is the oozing? Sticky, thick. So Jala, Prithvi. Agni के साथ जल और पृथ्वी महाभूत है उसमें. यहाँ पे देखो क्लेद, पाक, राग, right? What is there compared to this? What is the difference here? Sasnehata. Prithvi is there but less. Jala is there but less. Right? Prithvi Jala both are. Now here you can see Pedaka, Kleda Yukta. Pedaka and Kleda. I have added them in a particular order, like increasing. Dravata कैसे increase होते जाता है. I think I have added few more images. There I will tell you. Now इसमें क्या है? पृथ्वी महाभूत है. पाक के लिए अग्नि तो कंपलसरी है, राइट? कुष्ठ का डेफिनेशन ये क्या है? एक तरह का क्वथन, पोत जैसा बॉयल हुआ है स्किन. अग्नि कंपलसरी. अग्नि इज कंपलसरी वेदर इट इज वात कुष्ठ, पित्तज कुष्ठ, सन्निपातज कुष्ठ. पाक होने के लिए अग्नि चाहिए ही. अग्नि के साथ वात और कफ कैसे बिहेव करते हैं, क्या यू कैन से रिमेनिंग जल महाभूत, पृथ्वी महाभूत, वायु महाभूत एंड आकाश महाभूत, how they are associating with the Agni Mahabhuta, depending on that the presentation will be changed. Now you can see they are bulky, soft, right? Slightly sticky. Oozing is also there. So Prithvi associated with Prithvi dominant Jala. Right? Jala is there with that. Now you can see both are keloids on the chest. What is the difference here? In this, in both Prithvi is essential, Prithvi is there, must. But in this, along with Prithvi Agni essential in this, right? Prithvi and Agni are both are there. Keep in mind. Now in this, with Prithvi, Jala is coming. In this, with Prithvi, Vata is coming. That is why it is Ruksha. That is why it is Snigdha. Right? With Prithvi, Jala is coming. Now, Jala, Agni, and increasing association of Prithvi. Right? Here you can see completely watery secretion, non-sticky. It is not at all sticking. And very importantly in this, you have to note that whenever secretion is there, whether that secretion is showing the color of the underneath skin, means transparent, right? It is transparent. When turbidity increases, when Parthiva Dravya go on increasing in water, the turbidity of the water increases, right? So it is pure Jala, but Agni, with Agni. Lasika is Agni Jala. Lasika is Agni Jala, right? Now, compared to this is completely watery, non-sticky. Sticky नहीं हो रहा है. यहाँ पे watery, but sticking. It is sticking. So, when the sticking starts, take example of हम बचपन में ये पतंग वगैरह बनाते वक्त क्या डालते थे, कभी कभी पानी में व्हीट फ्लोर वगैरह डाल के, मैदा डाल के, या कभी कभी चावल भी लेते थे. पानी में चावल का पानी जो रहता है ना, उसमें थोड़ा चावल और मिल गया तो वो स्टिकी बन जाता है, राइट? सो व्हाट इज दैट? फ्लोर, मैदा और व्हीट फ्लोर और राइस, दैट इज पृथ्वी महाभूता. पानी है, स्टिकी नहीं है वो. उसमें जैसे जैसे पृथ्वी महाभूत ऐड करते जाएंगे, इट स्टार्ट्स बिकमिंग स्टिकी. सो द स्टिकीनेस इज बिकॉज ऑफ द एसोसिएशन ऑफ पृथ्वी विथ जल. अग्नि base, I'm telling, Agni is a oven. Under that, over that oven, everything is cooking, right? Now you can differentiate. Non-staining, purely Pitta and Vata, sorry, Agni and Vayu Mahabuta. Here, staining, Agni with Vayu, sorry, Agni with Jala and Prithvi. So I am getting confused. Okay, here, Agni and Jala Mahabuta. ये महाभूत के ऊपर ज्यादा बात नहीं करते ना, सो कंफ्यूजन नहीं होता. So Agni and Jala Mahabuta dominant. यहाँ पे Agni with Jala with little Prithvi Mahabuta, right? Jala with little Prithvi Mahabuta. If Prithvi Mahabuta increases, what will happen? You can see here, Prithvi Mahabuta has increased. It has become more sticky, thicker. Oozing is not there. There only it is clustering. उधर ही जम रहा है. तो क्यों जम रहा है? पृथ्वी बढ़ गया, पृथ्वी बढ़ गया. इसमें देखो पृथ्वी और भी बड़ा है, बाहर ही नहीं आ रहा है, राइट? बट दे आर नॉट हार्ड, दे आर नॉट ग्रैन्युलर, सॉरी दे आर नॉट नोडुलर, नॉट ग्रैन्युलर, दे आर नॉट नोडुलर. नोडुलर है तो क्या होता है? जल कम है, पृथ्वी के साथ वायु और अग्नि है, हार्ड बन रहा है. नोडुलर लाइक दैट की लाइट, राइट? कैन सी अगेन सेम पृथ्वी विथ जल, पृथ्वी विथ जल. And here also you can see Prithvi with Jala, sticky, thick, oozing. Prithvi with Jala. Now you can see Kapha is there, Prithvi is there. With that, Vata is more. Prithvi, Vata. Prithvi, Vata. Right? Prithvi is more. Right? Prithvi is more. Now, more Vata and Prithvi. Sorry, more Vayu Mahabuta with Prithvi. Now, more Prithvi, more Vata. So what has it has become like, Pashanavat Katinaha. Charkacharya says, when Kushta is having Pashanavat Katina, what he says for application of Chara, Agni, Vishalepa is also explained. By giving administration of Agada Yogas and then apply Visha and then remove and again apply Agada there also. Means, उसमें मेल्ट करना है. मतलब देयर इज वन मोर क्वेश्चन, लाइक मेल्टिंग मीन्स एग्जैक्टली व्हाट? लाइक मेल्टिंग मतलब धातु जो गना हुए है उसको निकालना है तो उसको द्रव करना ही पड़ेगा, अदरवाइज वी हैव टू रिमूव. छेदन, इफ वी आर नॉट एबल टू डू छेदन, व्हाट इज एक्सप्लेन इन टेक्स्ट? पाक. छेदन और पाक. ग्रंथि अर्बुद में क्या है? छेदन है, अग्निकर्म है. अग्निकर्म मतलब एक्सेस पाक, हर पाक मतलब जला दो पूरा, जला दो, क्षार क्या है? इट इज ब्रिंगिंग बैक ओनली, राइट? क्षार क्षणनाथ क्षरणाथ, क्षणना मतलब मारता है पूरा, टुकड़े 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 करता है, सॉरी एक्सप्रेशन, सॉरी, क्षणना मीन्स टुकड़े टुकड़े करता है, राइट? देन क्षार, क्षणनाथ क्षरण, स्क्रेपिंग, मतलब जो घना है, घन है, जो पृथ्वी में डोमिनेंट है, उसको मतलब ब्रेक करना है, ब्रेक करने के बाद ही हम निकाल सकते हैं, राइट? लाइकवाइज नाउ वी कैन सी मोर वाटर, मोर kapha, खरा, right? I think sorry, more vayu mahabuta and prithvi mahabuta with pitta will be there. Here also you can see more vayu mahabuta, less prithvi is there with that. Akasha is also there, that is why it has become thin. Akasha is also there, that is why it has become thin. I will tell you why Akasha is there. There is one question. Okay, so I think Mahabuta, how to understand Mahabuta is again Vipako Vyakta Karma. By Lakshana only we have to assess, right? Okay. Because Tridoshas are again nothing but they are also Mahabhuta Vikara only. Because Karana Dravya of the Sharira are Shardhatmatmaka Purusha, right? Pancha Mahabhuta and Chetana. So whatever is formed, that is formed because of Pancha Mahabhuta only. So that is why, for what purpose we are, assessing the condition, depending on that, we need to decide whether we have to go by Mahabhuta concept or like dosha concept, right? Like that. Though Thanu, and there is one more question, though Thanu and Ganakafa should not take liquid and solid exactly, shall we correlate them? Pancha Mahabhuta wise, Jala and Prithvi respectively, sir, yes. Like what I have explained now. Like Ganakafa, Tanukapha, still liquid, solid है वो actually. I think श्वासार कासे चिकित्सा in श्वास कासे चिकित्सा आचार्य चरके has explained Ganakafa, Tanukapha means what? Ganakafa means the one which is sticking, not, which we are not able to eliminate, remove it easily, right? That is Ganakafa. Tanukapha means it is flowing, right? It is flowing. We have to remove that. That type. Right here you can see Jala, Jala Prithvi, Prithvi Jala, जल अग्नि के साथ, जल के साथ पृथ्वी, यहाँ पे पृथ्वी के साथ जल, पृथ्वी के साथ जल. नाउ तनु little bit gana, little bit gana, more gana, and if it becomes hard, ati gana. So we can consider, but depends again the purpose for what we are considering it, depending on that it is determined, right? Okay. Again, this is also associated with Mahabhuta only, so that is why I added those basics ones. Respected sir, shall I presume Drava Pitta equal to fire plus plus, water plus, triple plus? Now, quantifying is very difficult. 1 plus equal to, right? So it is like in this. Pitta, Sasneya Pitta is fire plus plus, water plus plus, water 1. Like here you can see, this is Jala dominant Agni, right? This is Jala with Prithvi. This is Prithvi with Jala. This is Prithvi with Prithvi dominant Jala. यहाँ पे पृथ्वी एंड जल इक्वल होंगे, यहाँ पे जल ज़्यादा है, पृथ्वी थोड़ा कम है, यहाँ पे पृथ्वी बहुत कम है, यहाँ पे पृथ्वी थोड़ा ज़्यादा है, यहाँ पे पृथ्वी और जल ऑलमोस्ट इक्वल है, यहाँ पे पृथ्वी ज़्यादा है, जल कम है. नाउ अभी वी हैव टू कंसिडर देम लाइक 1 plus 2 plus, that is very difficult how to get that 1 plus 2 plus conclusion, right? Okay, so I think it is clear. Respected sir, shall I presume hardness dominant is Vayu plus Prithvi in the Panchabhautika system, like I have explained it, right? So you can consider Prithvi Mahabhuta dominant. If it is thin, Vayu dominant Prithvi you can take. If it is hard, bulky, Prithvi dominant Vata. Prithvi is more. So in this, Prithvi is more in the image. What I will show. Again, same irritation dominant Panchamahabhuta wise, Vayu dominant one. Yes, you can take, no problem. How to distinguish Vayu and Akasha in skin assessment? Say skin में Akash Mahabhuta assessment is like, I will give you example. Now this is Akasha, the Akasha Dravya. What is that Nidana? What dosha dominant Nidana we consume, that dosha particular guna Poshana takes place and that dosha gets aggravated. Same, which Mahabhuta Dravya we do intake, that Mahabhuta in the body, in the form of their karma, particular guna karma will be nourished, right? Right? This is Akasha Dravya. This is Mrudu Lagu Sukshma Lakshna Shabda Guna Bahulani Akashatmani. Right? What they are? Mrudu Lagu Sukshma Lakshna Shabda Guna Bahula. I think I told you that Ayama Sankocha Lakshna it is. So that is I told Vayu and Akasha Mahabhuta. Right? So Mrudu, if the lesion is Mrudu, Mrudu means don't take like the Mrudta of Kapha. Right? Mrudu means Mrudta is also there for Vata also because of Saushiryata, hollowness, Mruduta comes. Right? Like for example, the Stri is said to be Sukumara. Stri Sukumara. Why Stri is Sukumara? Is it because of Kapha? More Kapha? Sometimes what happens na, a lean person, male, compared to a obese female, weighs height same way, but the male is lean, whereas female is obese, but the lean male weighs more than the obese female. Why? Because female is Sukumara, Saukumaryata is there. What is brought by Saukumara is brought by Akashamahuta, Saushiryata. Saushiryata. So when lightness, that Saushiryata, Lagu is said to be Pradhana presentation of Akashamahuta. Right? So it is associated with Vata also, but it is Pradhana outcome. Like Karya of Laguta is Pradhana Karya of Akasha Mahabuta, Saushiryata. That is why balloon flies. Because in that Sushirata. Right? Sushirata is there. Right? So because of that. So what it does? These Akasha Dravyas, Mardava Saushirya Lagavakari. Right? Mardava, softness, Mrudta in the body. Saushiryata, hollowness, Lagava Karani. Increases the Laguta in the body. Right? So what are Akasha Mahabhuta means? How to consider? So I told you know the Dravyas with which the Akasha Mahabhuta dominancy takes place. By that the Lakshanas like Sushirata, softness, delicacy, Slakshnata, they all come because of Akasha Mahabhuta. Vayu, Akasha, that's Lakshana. Vayu Prithvi, Khara. Vayu Akasha, smooth, shiny, glossy. Right? Because if with Vayu, Akasha is not there, what will happen? Akasha is Vayu is Karkasha. Right? Why is Karkasha? It is not Saumya. Why is Karkasha, right? But when Akasha comes with that, it becomes Saumya. Smooth, shiny, glossy, Shlakshnata. But when same Prithvi Mahabhuta comes with Akasha, it becomes Khara, Parusha, like that. Okay. So what Acharya says? Atra Akasha Bahulyam Dravyasya Prithvyadi Bhutantara Alpattvena Bhuri Bhuri Vyakta Avakashattvena cha Jneyam. So what it means? Akasha Bahula Dravya matlab kya hai? Means it is absence of Prithvi Mahabhuta, Jala Mahabhuta, Prithvi Adi Mahabhutas. As the other Mahabhutas go on in decreasing in any Dravya, the Akasha Mahabhuta increases. Right? For example, rice से चुरमुरा का क्या बोलते हैं? चुरमुरा समझ में आता है? जो हम ये बनाते हैं ना क्या बोलते हैं? भेलपुरी वगैरह, कोल. Right? Compared to the weight of the rice, इसका उस एक राइस के वेट से भी कम रहता है इसका वेट, बिकॉज उसमें से पृथ्वी महाभूत और जल महाभूत चला गया बिकॉज ऑफ फ्राइंग. पृथ्वी एंड जल महाभूत गॉन. So what has happened? Akasha increase. So such dravyas where Prithvi and Jala Mahabhuta is less, they are to be considered as Akasha Mahabhuta. यदेव भूरी सुशिरम तन नाभसम, जहां पे भी सौशिर्यता है, हॉलोनेस है, एम्प्टीनेस है, पोरस है, दैट इज नाभसम, आकाशीय. क्यों वा आकाश गुण बहुलत्वेन नाभसः द्रव्यम इत्युच्यते. और such dravyas which are having sushirata, hollowness, porous in nature, they all because of increased saushirata, they are called as नाभस द्रव्य, आकाशीय द्रव्य. तो उससे जो भी presentations होते हैं, they all are to be considered as Akasha Mahabhuta. Right? Okay. Respected sir, it is said by you, psoriasis or any disease, while analyzing etopathogenesis, we need to find out target areas for the drugs, for the medication, treatment. Shall I presume out of doshas, dushas, rotas, agni, ama, avarana, doshagati, rogamarga, which is getting clear expression in clinical presentation, needs to be targeted for drugs come treatment? Kindly clarify. Exactly, it is same. But there are some things like, for example, dosha involvement and dosha dhatu dushti. can be seen even in Ama. Same dosha dushti, same type of dhatu dushana can take place in particular type of Ama. In Avarna also, in particular dosha gati I am not getting actually. Roga marga will be coming under this dusha. Right? So if Ama has led to the dosha dushti, then the dhatu presentation will also be same. But it is our duty to understand, because in this some are karya, some are karana. For example, dosha avastha, dusha avastha, srotas, agni, srotas, these are karya. Roga marga, these are karya. Whereas ama, avarana, agni, these are coming under karan dravyas. Internal etiology for the formation of the roga. Dosha, dushti, dhatu, dushti and all. Srota, dushti. Right? But dosha, dusha and srotas condition, these all are karya. Same Sotadushti can be seen in different type of internal causes. So depending on that, we have to select two medicines. One is for the Sotadushti, one is for the Karya. What has led to that? Right? In that case, wound, what is that Vipadika wound case? What we treated first? What is the cause of that Dushta Vrana type of presentation? Kleda. Dushta Kleda is the cause. So what we did in that first, we treated for Kapha Pitta, Nimbadi Kashaya, the Shangulika, Patolakatunadi, Nimbadi Kashaya, the Shangulika, Triplaseka and all, right? Then we tried to control Vata, and simultaneously we started using Asanadigan, that Ayastuti, right? Grita, Ayastuti. Again, last also we gave Grita, which was that Uglu Tikta Grita. Again, Kleda Hara, but Vata. So in that, Kleda is the cause. Because of that, it has. So if Ama is the cause and particular dosha dushti has led to particular dhatu dushti and thereby sruta dushti, then we need to treat for Ama and out. Because same outcome can be seen because of multiple causes. Right? So we need to treat for both. Right? I think it is clear. Namaste sir, sometimes in OPD we find similar presentations like that of Danta Kashtagata Visha, but due to adverse drug reactions of modern medicines, can we correlate them with Danta Kashtagata? Exactly, we have to take that one. That only you have to take. Sometimes what happens, patients develop allergy with the brush also, the plastic used with that also. Sometimes patients develop allergy, oral lesions with the particular change of toothpaste. So for that also we need to consider that as a chemical, as a visha to treat. Right? We have to treat for that. In Paduka Visha, case number 3, Vata dominant. Namaste sir, why Nalpamari Tela in this case? Nalpamari Tela is Pittahara. Can we give Eladi Tela in this case? I think this similar type of question we have answered in previous session, but still just I would like to, this type of patient, I think this patient only. Why Nalpamradi was used? I told, I think it is Kleda Pradhana. So in the beginning, we have to be careful about Kleda. So if we use the Eladi, which is not that Kledahara, compared to Nalpamaradi, Eladi is less Kledahara. So that is why we need to go with Nalpamaradi. Then we can go to, when more Vata becomes, at that time we can go with, like, when more Vata Kapha, less Pitta, Kleda is less, but Ruksha Kapha is there, at that time Eladi is. But when Snigdha Kapha is there, at that time we need to go with Nalpamaradi. So that is why Nalpamaradi was given instead of Eladi. Right? If you go through the previous session, like mastermind session, there I have explained that in detail. So what is the difference between Dushi Visha and Garavisha? Just Garavisha is a type of Visha. Tavara Visha, Jangam Visha, Kritrima Visha. Kritrima is Garavisha. This is the classification of Visha based on the source. Tavara Visha means they are originally vegetable and mineral origin, by origin. Jangam Visha, animate poisons, which are origined in the animal kingdom. Right? The third one is artificial. It is not natural. Anything which is prepared artificially is called as Garavisha. Right? For now. What is Dushi Visha? Dushi Visha is not a type of Visha. It is a stage of any of these three Vishas. It is when the same Sadhya Prana Visha. Sadhya Prana means any Visha which is having Dashagunatmaka, Dashagunas, which is immediately showing clinical presentation, is called as Sadhya Prana Visha. Right? Dashagunatmaka. If any Visha which is having less gunas, less than 10 gunas, then it will not cause immediate death or it will not cause immediate pathology. And those less potent Visha are called as Kalagati Visha or Dushi Visha, or you can call them as Kalantara Prokopik Visham, Dushi Visham. So on exposure, immediately they do not cause any clinical presentation. Over a period of time, with the help of supporting factors, they affect the body, they affect the physiology and cause the pathology. Such vishas are called as dushi vishas. Okay, I think it is clear. Respected sir, shall I presume in erythema and scaling dominant pitta vata type, it is fire air dominant one? Yes, we have discussed that I think in detail. Pitta kapha type fire air earth dominant one we can consider. Uh, shall I presume if more erythema is there, more fire and more scaling is more air? No problem. Tanu Udvrta Bhaisvacha is Vata, that is Vayu Mahabuta. Can take erythema is Pitta, so Agni Mahabuta. So again, it's like, are we considering it as red hot iron rod or boiling water? Now, erythema is not just because of Agni. It should be coming with Ruksha Agni. Vata should be there. So that is why it is the Vata Agni. If it is boiling water type, like erythema oozing and all, so it is the Jala Agni. Right? Like that we have to consider. Sir, Lodra Sevadi is, sir, it is available in market. You can search. It's available not as Kashaya. It's available in market as Lodra Sevadi Churna. Everest Pharma, Vaidyaratnam, like not Lodradi of Vaidyaratnam. I think Kotakal Ayurveda. There are so many pharmacies who are manufacturing it and it is available in market. But not as Kashaya. Lodra Sevadi Churna. It's available in the Churna form. And then we have to prepare the kashaya after. If any kashaya is available, I don't know, you can share that in the group or in YouTube if you have any reference about that. In this case, actually, Vipadika of this patient, sir, instead of Nimbadi kashaya, can we give Guduchadi kashaya on the first visit? It is Pitta Vata dominant in this, right? This is a case of soap induced and all, I think. Contact poisoning type of Vipadika it is having, I think, aggravates by the use of soap and all. So here, why Gudichadi was not given? Instead of that, Nimbadi was given. Because Gudichadi is, Kushtagna is secondary karma of Gudichadi Kashaya, right? We can say it is Akledahara, not Kushtagna Gudichadi, basically, right? Not Kushtagna. It is a kind of Rakta Pitta, that type of presentation. Whereas Nimbadi is Kushtagna primarily and Kledahara. Nimbadi is primarily Kushtagna, Kledahara, Pitta Kapahara, and healing is also there. So that is why Nimbadi is preferably the better choice. In Danta Kashtagata Visha, these are mixed, 3 different questions are there. Namaste sir, please suggest Kashaya names and how to use those and Agadas. Please tell internal medicines for Avalekana Visha. Here also, please try to explain about internal medicines guidelines. So here, what is very important is, again, Karana specific and Karana specific. Karana specific, if it is due to Visha, what type of presentation is there? Is it type allergic type and all? Then we can go with Dushi Visha. Itching and all is happening. No inflammatory changes. Right? If inflammatory changes are there, we can go with Bilwa. If more inflammatory changes, go with Dasha. Right? More inflammatory changes, 1 or 2 days or 3 days, you can give. For short period, you give Dashanga. Then switch to Bilwadi as the inflammatory changes reduce. And then you can end with Dushi Visha. And Karana specific, what dosha dominance? Whether if it is caused, for example, let us say sometimes these tooth fillings cause kind of oral lichen planus type of presentations, right? So consider it as Visha, that as the metal led to that toxicity, we will consider it as Visha. And the outcome is, so we are giving Vishagna, we are giving one Vishagna, Dushi Vishari we are giving. Now outcome, what is the outcome? Whether it has caused hyperpigmented dryness, increased dryness of the mouth, so then we have to go with Vatahara. Like we can suggest Kavala Gandusha with Tailas and all. Right? Internally also you can use some Grutas and all. Right? If that has caused what is that? Restricted movements because of the fibrosis, then we can go with Grutas and all. Right? If something same has led to Mukapata, right? Erythema and all. So then internally also you have to give Pittahara, Pitta Shamana Dravya, Kushtagna. And for local, Panchavalkala Kashaya, or you can give Tripla Kashaya, or Saptachadadi Gandusha, it's available in market, you can give that. Or if it is not available, just Saptachada. Saptachada plant is there, a bark of that can be used for preparing Kashaya and that can be used for gargling. See? So depending on Shamana Aushadhis will be dependent on the clinical presentation. dosha assessment and same. So same is the thing. In Mukalepa Visha also same. Namaste sir, if patient have pigmentation without use of cosmetics, then can we treat the patients with same line of treatment? Same query about acne also. So same, you can use no problem. Again, what for we are going with Vishagna Chikitsa? First thing you keep in mind, whatever the diseases or clinical presentations explained in Vishadikaras are not new ones. They are not new ones. Not a single Lakshana is new. They all are the same Lakshana, same diseases that we study in Kaya Chikitsa. Even the Shamana Aushadhis are almost same as that are recommended or used in the Kaya Chikitsa. Only what is the difference? Vishagna Chikitsa is the difference. So, if there is association of Visha, then go with Vishagna. Along with that, as per the requirement clinical presentation, Shamana Aushadhis. Whether it is pigmentation or acne. Right? Here one more. Can we use Aragyavardhini? Can we use, Namaste sir, can we use Aragyavardhini always in all types of skin diseases? And can we use Vilvadi Gulika instead of Dushi Vishari Agada? If not, why? It's not about the medicine. It is not about whether we have to give Aragyavardhini in all skin diseases. No. It is for what we are giving. What is the need? What is required in that disease? If the disease requires Aragyavardhini, we have to prescribe Aragyavardhini. If disease is requiring Avipatti Churna, we have to give Avipatti Churna. If it is requiring Patola Katvanadi, we have to give Patola Katvanadi. If it is requiring Patola Muladi, we have to give Patola Muladi. If it is requiring Rurutlaya, we have to give that. Manipatra Guda, we have to give that. Means why I am telling all in the direction of Pittahara. I think in last session, previous that live session, we have discussed Ghana Pitta, Drava Pitta, Alpa Pitta, like that. So based on that, what is the purpose of the use, purpose of that medicine? What is the condition in the body, the pathology, and what type of medicine is needed? Depending on that, you have to use Aragyavardhini. I do not use Aragyavardhini in all patients. No, not necessary, because what is needed, not the medicine. Whether the condition requires that medicine or not, that we need to understand, right? And Vilvadi and Dushivishar you cannot use as alternatively, but I told you just now, oral I was explaining. If more inflammatory, fever is there, pitta, spaka and all is there, in such conditions, Bilvadi is good. More pitta, more jora and all, Dashanga is good. If it is less of that, Kandu Pradhanam and allergic type of presentations, then Dushivishar is very good, right? Again here in Mukalepa Visha, if patient have more like appearance over face, neck, nape of the neck, then can we use same type of treatment principle? In modern, laser treatment is used for tiny moles. No, we cannot use same like Mukalepa Visha, because the presentation. We have to consider them as Charmakila or Chatumani or something like that, Tilakalaka. So what is the treatment explained there? Modern they go for laser treatment. No, same exact in Ayurveda. So Acharya said whenever there are moles, like pendulated are there, like that raised lesions are there. I told you Pashana, Katina and all. So what is the karma? Kshara karma is there. We can go for Kshara karma or Yeladi Churna. I commonly use Yeladi Churna. In that, like Yeladi Churna, as our teacher used to tell, Yeladi Churna you have to take and we have to soak it with like sour buttermilk or Dadimanda, sour Dadimanda, Amla Dadimanda, and with that we have to make it like like Udvarkana Churna, and then wherever they are, we have to make round massage for few minutes and then paste it there only. Remove after 10-15 minutes. Then there will be some type of irritation. So after that, you can apply Yeladi Taila or even coconut oil. That can also be done. You can, if it is there is viral warts and all, viral infection due to that, then along with these external, you can use Bilvadi and Asanadi Kashaya also, because it is Kapha Medo Dushti. Meda Kapha Dushti will be there. So that is why Asanadi Kashaya can also be given to prevent the recurrence or to prevent the increase of the number of those moles, right? In Paduka Visha, you told Patola Katvanadi Kashai used, and again PKR used in with Viladi Kashai, means 2 times we should use. Seka means just like it's not 2 times. Empty stomach, we are giving Patola Katvanadi with the Bilvadi, it's like that. Means 3 times we have to use it, morning, afternoon and night, with Kashaya, like tablet. It's not like first you give Kashaya and then again with tablet also you give. No, it's not like that. 1 time. Seka means yes, it is just pouring, washing. Sir, again, one more question. If Manjistadi Taila is more Varnya than Eladi Taila, then why you use first Eladi, lastly Manjistadi in this case? It is same we have discussed previously, but the context where this question was asked, this question is asked in this case. So here, what I told here, like Patola Katranadi Kashai, 15 ml twice daily on empty stomach with warm water. Vilvadi Gulka, 2 tablets twice daily with Patola Katranadi Kashai. So it is not after food. It is with the kashai only. Empty stomach only, Bilwadi and Patolakatoni are given. Aragvardhani was given in between food. Punarnavasava and Lohas was given after food. Right? So this with Patolakatoni means not separately. मतलब सुबह 30 ml नहीं देना है. 15 ml kasha, 2 tablets, with that only it is to be given. Right? Like that. Aragvardhani in between food, Punarnavasava and Lohasava after food. So in this patient only, same question. So this was the condition where I used the Eladi Tela, right? I prescribed the Eladi Tela. So what is the question here? Mostly discoloration is there. Why you not used Manjistadi? Instead, at this stage, I gave Manjistadi Tela. Why you are given in Manjistadi here? Why not in this stage? Right? So this stage, you can see, still the lesions are elevated. Thick lesions are there. So clay is there. We need to give something Varnya, but simultaneously clay Dahara. So Eladi is clay Dahara and Varnya. Here what happened, we admitted the patient because he had some Pandu and other things. So we did Snepana and all, Virechana was done. After Shodhana, when we confirm that clay is less, lesions also you can see they are very thin, dry. So I went with Manjistadi Varnya, but not clay Har. Right? So when clay is suspect at that time, we should not use something which is clay Kara. How can we diagnose? How can we diagnose? Is it contact Shvitra? If not, document proper history, or in chronic cases, is it spreading or localized? So usually contact se hone wala history main. If history is not there, the site, about the site. If for example wrist watch agar wrist ke jagah pe ho gaya, site will tell now what is the common site. It's the site for what? यहाँ पे हो गया, nose के हो गया, या बिंदी लगाने की जगह पे हो गया. So site will tell us the probable association. Next is first. Second, usually these things do not spread. Usually they do not spread, they will be localized. But sometimes what happens now, the patients who are prone to get depigmentation, there will be condition like Shvitra-like presentation. So in them what happens, allergic leukoderma leads to itching. So that scratching, wherever it starts causing scratching and wounds will be there, those wounds start showing depigmentation because the tendency of depigmentation is there in that person. So that is why it is spreading. Right? So again, treatment will be same. Treatment will be same. Sir, same type of principle can we use in both types of Abarna and Paduka Visha? Like same. Acharya only said Abhyanga Visha Chikitsa only means Chikitsa line will be same. Vishagna and according to the clinical presentation, Doshagna. One more is with Shvitra. Sir, Shvitra is Vata Pradana and used Asanadi Kashaya Vata Pradana Dravyas. Please explain. So it is one more, I think one more question is there. So Shvitra is Vata Pradana and then again Asanadi Kashaya is prescribed. Same. Shvitra is which dosha pradana? Vata or Kapha? I don't understand. Please explain. Asanadi Kashaya is mostly used in Kapha dominant conditions. Why it is used in Shvitra? Shvitra is Vata dominant tridosha, right? Okay. Sometimes Pitta dominant tridosha bolte hain. Pitta Vata dominant, but Varna is Agni, right? So Vata dominant tridosha. Now here, why Asanadi Kashaya? Now Asanadi Kashaya, will not go into the ingredients. You can see Asanadir Vijaye Chvitra Kushta Kafakrimin Pandurogam Prameham cha Medo Dosham Nibarhanam. Now first we will consider Panduroga. Pandu is Dhatukshayaja Roga, right? Dhatukshayaja Roga, Panduroga, and Asanadi Dhatukshayakara. Medohara. Right? Kafa, Medohara. Medo Dosha Nibarhanam. Why it is used in Pandu? The Samprapti. Avaroda, if there is Avaroda, that has led to this, then that Kleda Hara Chikitsa is needed. So, Shvitra is Kleda Pradhana Roga. Kleda Pradhana Roga. So, when we are selecting medicines, somewhere I have explained, when we are selecting medicine, very important things that are to be considered is Rogagnata, Karma, Doshagnata. Rogagnata, Doshagnata, and Karma. So, Rogagnata we have to consider. If you feel, sometimes I ask the patient, like the patient is obese, we give Asanadi Kashaya, even Asanadi Churna also I give. I do not give anything else with that, right? But sometimes if patient is lean, consider Vata is more. So I give Asana Churna with milk, Asana Kshirapaka, which is there in one of the reference in Ashtanga. I think we have discussed that. Asana Kshirapaka is recommended for Shvitra. So I give Asana Kshirapaka because it is controlling the Vata Prakopana effect of Asana. Right? Asanadi Kashaya, Ayaskriti. Now, more Kapha and Lekana property is needed. So we give Asanadi Kashaya in the form of Ayaskriti, which comes with Loha also. Right? So it is Rogagna. So we have to make it suitable for the dosha with the associated medicines. Either making it as Kshirapaka and all, or giving it Asanadi Kashaya. With that, you give some Grita, which is suitable for Shvitra, like that. So Rogagnata is given importance in Shvitra, not dosha. So depending on the prakriti of the person, we can change that. In contact dermatitis part 2. Sir, Namaste. Pidaka with severe itching, Shava Varna and with powdery scaling, then is it to be considered Vata predominant, Vichachika or Kitipa? Now, again, why we want to diagnose? Why we want to diagnose a disease? To treat the condition, right? So, if the purpose is to treat the condition, don't worry, whatever you diagnose it, no problem, right? Because we are going to select medicine for the dosha. If we want to diagnose any condition as Vicharchika, it should have Kandu, Vidaka, Shava Varna, Srava. Srava, as it reduces, it becomes Kitiba. Shavam, Kinakarasparsham, Kandumat, Parushasa. Lakshanas are almost same. What is absent? Srava is absent. Why Srava is absent? Because Pleta is there. Kapha is less. Or Kapha, villain is not taking place. If villain is there, you consider it Vicharchika. If it is not there, then you consider it Kitiba. In between it is there. Sometimes I write like Vicharchika, Aroma, Kitiba. Vicharchika progressing to become Kitiba. Sometimes I have written in my case papers like diagnosis Vicharchika, aroma to Kitiba. Vicharchika progressing to Kitiba. That chronicity. Right? Chronicity. So purpose is selecting for the purpose of treatment. So itching, Shava Varna, like Pidakas are there. Pidaka means there is Pidaka, then it should be near to Vicharchika. If the Pidakas are hard, like the one foot I shown where black lesions were there, if it is like that, then we have to take it towards Kitiba, right? I think this is second last. This is somebody, I'm not remembering, tried to praise and explain like how videos are very beautiful, classes are very beautiful, helpful and all. Thank you so much for your uh, like opinion about the course and the content. I think this is the last one. This is for those who have not joined. If anybody, those who are watching our session on YouTube, and those who have not joined but still on Zoom, for them, this is a 50-hour course. There is now we have Ayurveda Day offer and Navratri Ayurveda mix. So you can join at just 6,000 rupees. Others who have joined for higher price, please don't blame me. You will get benefit of that in future when we launch other courses, right? Like if you are any of you want to join in bulk, like anything like more than 5 at a time, if 5 plus people are going to join, then the same course you can get at a reduced cost of just 5,000 rupees. Just 5,000 rupees per head. But minimum 6 members should be there at once, right? Okay, thank you for this. I think I have satisfactorily answered all your questions. If any of you have any questions, you can ask me. If there are any questions, you can ask me. There is one question. In pus discharge, which Google preparation gulika, like pus, whenever there is pus, I think I am audible. Preferably Google Grita we have to use. Like Nimbari Google we have to use. Nimbari Google is good. Pressure Google is not that suitable for Paka associated conditions, pus and all, right? So Nimbari Google is good. Any lab test for skin disease? Dr. Praveen, I literally do not do any lab investigations. Not needed. Sometimes we refer wherever we suspect of any communicable disease. For example, sometimes we get leprosy patients and all. In such patients, I send the patient to leprosy center. Otherwise, I do not go for any type of investigations. Sometimes what happens now, patients insist us to do tests. So many times I educate the patients also. not needed like that, right? But most often what happens, we treat second and third hand patients. So they come with already, done lab reports only. But as most of these, for example, allergic condition, for example, शीत पित्त patient comes and asks, sir, can we do test? अगर एसी इंक्रीज भी आएगा उसमें, अगर एसी इंक्रीज हुआ है तो हमारा ट्रीटमेंट चेंज होने वाला है क्या? नहीं, तो उधर बढ़ेगा ही, बड़ा बड़ा ही रहेगा. ओनली फॉर द डॉक्यूमेंटेशन पर्पस, इफ यू वांट यू कैन डू, राइट. Please explain the treatment of sandpaper like Kitibakushta. In that condition, we are Lekhana and Tikshna Lepas necessary. It can be done, but Grita should be given. Gugulukta Gritas you have to use. Whenever there is Vata with Vayu Mahabuta and Prithvi Mahabuta, so that should be broken. But that cannot be broken with like a, क्या बोलते हैं, हथौड़े से ब्रोक किए जैसा नहीं, स्निग्ध और तीक्ष्ण लेखन प्रॉपर्टी चाहिए. सो गुगुलयुक्त घृतास आर बेस्ट. एक्सटर्नली यू कैन डू that one, lepa, तीक्ष्ण लेपन and all, but internally we have to give गुगुलयुक्त घृतास. Exposure to antibiotics after viral or bacterial infection lead to hyperpigmentation. What should be the way of thinking or treatment? Like sometimes it happens with even what is that, respiratory allergy patients. They take medicines for respiratory allergy, they develop hyperpigmentation. So I preferably give Shirisharista in that, because Shirisharista is suitable for, it is Vishagna and respiratory suitable. With that, Dushi Vishari I give, right? So now you are telling pigmentation, so you can use same type Dushi Vishari with Varnya otherwise. Manjistadi Kashaya, Dushi Vishari, Mahamanjistadi Kashaya, Dushi Vishari, Varnya and the Dushi Vishari or Vishagna, right? It can be used. So can Dushi Vishari cause no, muscle weakness? Muscle, I think. No, Dushi Vishari cannot cause muscle weakness. How to treat warts, sir? Warts, like we have to go with Kshara Agni Karma only, madam. But to prevent recurrence, we have to use Asanadi Kashaya, Ayaskriti. They are very good. Fine warts are there, like the moles, which there was one question. It was like that, then Eladigana Churna and all, that can be done. But they are major, then we have to go with Kshara Agni Karma, like that. And internally, we have to give preventive, like, Asanadi Kashaya, Nimbadi Gugulu, Kashuru Gugulu. Amritadi Gugulu can also be used in such conditions with Asanadi Kashaya. Ayaskriti can also be used. In Shita Pitta with hypotension case, that I asked you for message, got 50% results with Nimbadi, Dushi, Ushari, Vilwadi. But sir, he got severe weakness, could not stand even 10 minutes. What must be the cause? Also, please tell the purpose of above line of treatment. Okay, so I think this Dushi Vishari muscle weakness is no. Maybe the Nimbadi might have caused clay dharana, like I told clay dharana, dhatu shoshana, it causes tikta rasa. Ati tikta usually makes the person weak, right? Tikta is said to be balakara, matlab sandhanakara. When more loosening is there, at that time tikta brings compactness. Kashaya makes it more worst, right? But when more, this tikta brings that shleshma to the sammanana by reducing the jala from there, right? Kashaya, what it does, Kashaya completely takes away entire rasa and it becomes very hard. So same might have happened with Tikta rasa of Nimbadi Kashaya, that led to increased shoshana. So because of that, patient might have developed weakness, right? You can replace that, you can stop that one, you can give Dushi Vishari, Haridra Kanda, that can be done. Kshudra Rogas, very sure, sir, very shortly. I am preparing on other skin disease also. Surely will come. They all will come in short time. Any other questions are there? YouTube, there are no questions. Okay, any other questions are there? There are no questions. You can. One more is there. Exposure to antibiotics after viral bacterial infection led to discoloration. What should be? I think I told this one. I explained this one here somewhere. It was there. Antibiotic exposure. Yes, Dr. Kirti, I have explained that one. Like hyperpigmentation. So you have to use Varna like Manjistadi Kashaya and all, and Vishagna, Tushi Vishari. You can use with that, right? Like I gave example of respiratory allergy medicines. Astalin, something it was patient was taking. It's a small kid, matlab, small matlab 15 years, 15, 14, 15 years boy. He had asthma issue and he used to take inhaler use karta, that pump will be there na. So and because of that he developed hyperpigmentation. Gradually we even stopped that use of the Astalin, I think I'm not remembering. Modern medicine, I'm very poor. So we stopped that even gradually. We switched with Shirisharista, Haridrakanda, Dushivishari, and then gradually stopped that one, and it improved even color. If it is 20 years old, patient aged 83. Sir, again, we have to treat for the dosha assessment only. Like 83 means better, we should go with Shamana Sneha, and mild Pitta like Patola Katvanadi or Nimbadi, and Grita preparations will be preferably better. Like if more clay is also there, then we can go with mild Kalyanka Grita or something like that, but not very much like Shodhana type excessive use of Patola Katvanadi and all. Can go with just even Aragyordhani, one tablet twice daily, thrice daily can be given. Nimbadi is okay. Nimbadi can be given. Grita, Tikta Grita, Kalyanaka Grita can be used, sir. Because the age is 83. That is what. Age is also Vata dominant, and history 20 years old again. Jara, what is that? Vyadhi Karshita, because of that also it is Vata is more. So that is why I think it's better we have to go with like Shamana Sneha approach. Any other questions are there? Okay, if there are no more questions, we will close today's session. Uh, yes, Dr. Satish, you want to say anything? Yes, sir. Yes, sir. Okay. Thank you, everyone, for being with us, and wish you all a very happy Navaratri, Ayuth Puja, Dasara, and let the new year be come with lots of prosperity, good health, wealth, happiness, success, and good results for all your treatments to your patients. Thank you for joining with me, and see you again in one more future session. Take care. Namaste. Thank you, Doctor. Namaste. Thank you.